Welcome to our Boston Hope COVID-19 build-out and rest of the story presentation. We have a great panel with us today, but just who all were personally involved with the build-out, and we have a video which we'll be showing in a few moments that you'll see each of them had a key part in creating this this award-winning project. Here at the CMAA New England, as all the chapters, we have a Person of the Year that we normally give out. This year, due to the unique circumstances, we actually recognized a Team of the Year, and that was the Boston Hope team, and basically coupled with an incredible build-out story by Suffolk, and then basically the overall logistics operation coming from home base, a part of Mass General Hospital, dealing with the overall logistics between the build and how to staff it and pull it all together. We're going to hear a great story today. For those of you out of the area, Boston Hope was basically a field hospital built in the Boston Convention Exhibition Center. It's in final build-out, housed 1,000 beds, 500 of them for the homeless and COVID affected, and also 500 for COVID treatment of ones which were not requiring more specialized care to allow them to stay in the hospital, but it was to unburden the hospital as the surge was coming this past spring. The Boston Convention Center was a great facility to build this in. It's a 500,000 square foot facility. From a size perspective, you could either put 3 football fields end to end or 6 side by side. They would fit inside this facility. Utility grid was great on a 30 by 30 grid that they could port into and connect for all the electrics and telecom. And then basically was a 30 by 60 grid for water and waste, which is also very important to a hospital situation. The facility was built out in 6 days. It started receiving patients, and 2 days later, it was fully operational. It was actually, as I said, split into 2 500 unit areas for the homeless population that was being treated, and also for the overflow coming from hospitals to unburden the acute care areas. But it had everything that a hospital would have. It had X-ray, it had physical therapy, respiratory therapy, mental health therapy, all the things that you would need in a hospital was all taken care of by this great build-out. So why don't we move forward, and I'm going to, I'll rejoin at the end of our video. Is about a 7-minute video by Suffolk and about a 7-minute video of our keynote speaker, General Hammond, and we'll get into bios and introductions of our panel shortly afterward. Thank you.
Coronavirus cases doubling roughly every 2 to 3 days.
Every day it was just like, what is going on? You're seeing the results coming out of New York and how it's kind of creeping now up to the northeast, the Boston area.
In the interim, Boston hospitals are preparing, as best they can, for an unknown number of COVID-19 patients.
It was like nothing I've ever seen before, coming into the city every day, driving around the city and just seeing nobody.
Pressure on frontline healthcare workers is already intensifying, even though the surge of COVID-19 cases has not hit yet.
One of the major concerns at the time was the prospect of our healthcare institutions in the city becoming overwhelmed, in particular the ICUs.
And now a field hospital is getting ready to open in Boston. Governor Baker announcing today that crews are setting up 1,000 beds inside the Boston Convention and Exhibition Center.
It's being called Boston Hope Medical Center.
As soon as I got the call that I was going to be part of this project and part of this team, the first thing that was going through my mind was, how are we going to make this happen? We really needed experts from every area. So we needed medical experts, we needed construction experts. We had to build a hospital from scratch in just a couple of days. We didn't have a lot of time, and we needed to come up with a plan.
The first meeting that we were a part of, we sat down and looked at the initial plans and how it was going to be laid out. And then we were asked to go to the convention center to take a look at it to make sure that the plan would fit and it made sense.
The first walkthrough was extremely eye-opening. Every single team was represented at that walkthrough. Medical compliance, HVAC, the BCEC, Suffolk, Mass General Brigham, and all the various doctors that were involved at that point.
The BCEC is basically one big massive space, and if you walk in, it's this enormous volume of area that's 100 feet tall. It's 3 football fields long. When we were there and we kind of looked and saw how the convention center was built and how some of the utility connections were laid out, it lended itself to be a perfect field hospital because everything we needed from a utility connection, electric and plumbing, was right there on the floor, ready to go.
We had to move fast, but we had to be smart about it. Came up with this whole concept of making these prefab panels standard sizes, 8 by 8, right? It's 2 sheets of drywall.
In hindsight, that was a critical decision because you're not building a 1,000-bed field hospital in 6 days without having a good chunk of it prefab, and those walls were key.
The build started on a Saturday morning. Got out there bright and early in the morning. Prefab panels just started coming in trailer after trailer.
We had massive crews of upwards of 300 people working around the clock. We had carpenters, builders, pipe fitters, electricians, teamsters, plumbers, really every trade that you could imagine to make this build.
We were all over every square inch of that building. There was one person on our team that had walked 21 miles in a day.
Beds are still on the way, but construction crews are busy raising temporary walls. Mayor Marty Walsh says the field hospital inside the BCEC will give other frontline hospitals breathing space.
The way they build in the convention center is different than how we build out on our projects. But everybody was reacting to things in the moment. It's not like one of our projects where you have a set of drawings, you have a schedule, and a plan that you've thought about for months to execute on. We were making it up as we go.
We were there originally to do the 500 beds, and it was about our second day into the build. And one of my bosses came over and said, "Hey, it's coming tomorrow, but we're gonna have to do another 500. Called our prefab guys up in New Hampshire and told them to make some more panels.
So probably the greatest example of how things were ever changing was the day they came to us and said we need to add oxygen to 100 of the beds. On a typical hospital campus, there's an oxygen tank farm with several massive tanks of oxygen that are just ready to tap into to supply oxygen throughout the hospital. The one challenge we had was finding tanks in the middle of a pandemic because not only the country but the rest of the world is trying to find oxygen for this respiratory disease. We were able to find a company in Texas. The tank showed up, we got them off the flatbed, connected them about a day, and that's how that came together.
We were really careful to make sure we were covering all of our bases. We wanted to make sure that we weren't leaving any stones unturned, that we were attending to every detail to make sure that the space was going to be ready not only for the build out, but for patients to come in about a week later.
The state's largest field hospital is now open. The Boston Convention and Expo Center is now being called Boston Hope.
There are 1,000 beds, more than 50 nursing stations, a half dozen short-term urgent care stations, and a physical therapy suite.
This was a massive undertaking, and it's remarkable to see it come to fruition in just 5 or 6 days.
To have started the build on a Saturday and to be accepting patients the following Friday in a facility that can provide care for them is pretty remarkable.
I remember there's one spot you can go to in the convention center where you kind of get a bird's eye view of everything, and you can kind of look on and you can see the 1,000 pods. I just remember watching all of that come together, and I think all of us kind of just feeling like, in a very small way, we help the city, we help the people in it try and get through something that, none of us in our wildest dreams could ever imagine.
The point here isn't that we built a field hospital in 6 days. The point is that this amazing group of people came together from all different fields and walks of life, put aside their own anxieties and fears about the situation and what was going on in the world, and did whatever it took to make this happen.
Boston Hope opened in April specifically to help treat people during the pandemic, and more than 700 COVID-19 positive patients were treated there over the past few months. Staff and volunteers and the patients themselves cheering and some crying tears of joy after victorious fights against COVID-19. 68-year-old Joseph Murphy of East Weymouth, he's one of the men there. He spent 36 days at Boston Hope, and that is something for sure to cheer about.
Hello everyone, my name is Jack Hammond, and in late March 2020, Governor Charlie Baker called me and asked me to lead an effort to build and open a 1,000-bed COVID-positive field hospital in downtown Boston at the Convention Center. As you can imagine, this was an extremely difficult task, and it would not have been accomplished if it weren't for the amazing work of the men and women working for Suffolk Construction Company. I want to add my thanks to many others, to John Fish and the team at Suffolk for what they did and the way they pulled together to make this a success. Boston Hope represents what we can accomplish if we all work together. Everyone that worked at Boston Hope had one common theme in mind as they came to work each day. Every doctor, every nurse, every tradesman, laborer, policeman, or soldier. Failure is not an option. Our backs were against the wall, the surge was mounting, and we knew that if we did not do our jobs properly, the hospital systems in Boston could fail, potentially. Boston Hope was a public-private partnership between the governor, the mayor, and the CEOs of our hospital systems, city, state, and federal government, Boston Police, State Police, the National Guard, and competing hospital systems. When the governor called me, I knew what the stakes were, and I understood the challenge. In my previous life as an Army officer, I've dealt with expeditionary operations in austere environments where you have to get by with what you have. It all comes down to people and stuff. You need to have the right people, the right leaders, and a motivated team, and then you need to have the resources to succeed. Frankly, Suffolk Construction provided us with the crucial resource, which was a field hospital. When I got off the phone with Governor Baker, I had one of those moments where I sat and reflected upon the conversation, and I realized at that moment that we had a few challenges. A moment ago I mentioned that we're going to need people and stuff. Well, at that moment I realized we're going to need a lot of people, roughly 1,000. I know we're going to need a lot of stuff. We're going to need hospital equipment, we're going to need monitors, beds, and of course the field hospital. And then we're going to need money to operate it. And at that point in that conversation, we didn't have any of those things. A short time later, I spoke to Mayor Marty Walsh, and he had told me that he had already been in conversations with Suffolk to start getting after this construction project as soon as we locked in all the negotiations and deals, which only took a short time from there. But from that moment forward, I knew that this mission could be accomplished on time and on target. A vision without resources is a hallucination. And frankly, with the support of the governor and the mayor, we had great vision, but the resources needed to come from somewhere, and fortunately we found a great friend in the CEO of Mass General Brigham, Dr. Ann Klebanski. And when Ann made a commitment to support the construction and the operation of Boston Hope, we were right where we needed to be. First thing we had to do then is build a team of teams, and that's exactly what we had. The Boston Hope staff, the Suffolk team, the BCEC team. We had a Reserve Army hospital. We had the National Guard. We had support teams from the city and the state and each of the hospital systems, all working with one focus in mind. We need to take care of these COVID-positive patients and keep them healthy and safe so that they could return home without having to go back to the hospitals they came from. Boston Hope had many successes. First and foremost, the construction of a 1,000-bed hospital in just 5 days. Now this is 1,000 separate rooms with oxygen piped to at least 200, an x-ray room, 6 intensive care unit rooms, 60 nurses stations, and just imagine all the things that go around with building a hospital. We needed each of these things in support, to include the team from Spalding Rehab building a complete rehab area to help these folks get along. We had a partnership with the Boston Healthcare for the Homeless team because 500 beds were going to be reserved for COVID-positive patients that were unsheltered. And so we had 3 levels of acuity for patient sickness with respect to COVID illnesses. Boston Hope required us to finish building the plane while it was going down the runway, as the teams from Suffolk Construction were working 3 shifts a day round the clock to build the field hospital. At the same time, we had to work diligently to staff the hospital. And this was no small feat. We were operational within 7 days and fully operational within 12 days, hiring 1,000 doctors, nurses, and support team members, and adding an economic boost to the area, given the fact that many of these folks had been furloughed from their jobs. Boston Hope treated 750 COVID-positive patients and had no deaths and no safety violations. That's an extremely significant feat for any hospital, regardless of where you were or the conditions you worked in. As I mentioned at the beginning of this conversation, this was all about having the right people and the right stuff, and at Boston Hope we had that. Again, I want to express my deep thanks to the governor and the mayor for placing this trust in me to operate and lead this effort. Certainly Ann Klebinski and John Fish for the manner in which they work together to support and resource this amazing collaborative effort. And then, of course, the leadership at Boston Hope, Mr. Michael Allard, who is the Deputy Commander for Boston Hope, Jeanette Ives Erickson, who is the Co-Medical Director and Chief Nurse, Dr. Giles Boland, who is the Co-Medical Director, Ms. Laura Lakin from Home Base, who is the Site Commander and responsible for the day-to-day operation of this amazing hospital, Dr. Rich Ehrlichman, who is a combat army surgeon with me in Afghanistan and a Mass General doctor I reached out to early on in this operation to get him involved and help me get going and get it off the ground. And of course, Dr. Ron Hirschberg, who became our medical director on the floor, organizing the daily clinical efforts at Boston Hope. This was an amazing opportunity, and this just shows what the people of Boston can do when they come together, work together as one in a unified effort. And again, I'd just like to close by adding my thanks to many others, to Suffolk Construction for making this a reality.
Welcome back. I hope you really enjoyed that presentation. I'd like to get through a little bit of housekeeping right now, and then I'll go into our bios. So we invite questions. We have some questions we'll be asking to facilitate conversation among the panelists, but we really invite questions. And so in your tab that sets up your controls, you are all muted by our organizer right now, Austin. But if you want to ask a question, tap the raise your hand function. You'll be put in the queue, and then when we're ready to ask that question, we'll announce that so-and-so, John Smith, has a question, and then you can ask a question to the panel in general, or you can actually identify one of the particular panelists for your question. Yeah, and like I said, don't be shy. If you have a question, a lot of other people probably have the same question, and we really welcome a true discussion. So getting through the rest of the pleasantries, I will act as your moderator today. I'm Michael Bertelin. I'm a principal project manager with WSP in Boston, having worked on many large, complex urban transportation projects, from the Big Dig to the Midtown Tunnel to the Port of Miami Tunnel. Did some work on the Alaska Way Tunnel. I'm an underground guy in general. I'm also past president of our local chapter of CMAA in New England, board member for 10 years, and also a co-chair of our awards program, which we put on 2 weeks ago as a virtual event, as we've all struggled to deal with the pandemic and basically the outcome of COVID-19 and what it's done to us. So moving right along, I would like to introduce our panelists. And the great thing about the panelists is that you've already met them in the video. So first up, we have Jason Seberg. Jason is Vice President of Operations at Suffolk, where he leverages more than 20 years of industry experience to deliver success to complete projects. In his role, Jason builds collaborative client relations, leads high-performance project teams, directs pre-construction efforts, and ensures that all projects adhere to Suffolk's highest safety and quality standards. Jason has overseen major life science and healthcare projects like the new 6,800 square foot Brigham and Women's Hale building for transformative medicine, and the new 600,000 square foot inpatient tower for Boston Children's Hospital Hale Family Clinical Building. Jason has a BS in construction management from Wentworth Institute of Technology. Second up, we have Drew Parkinson. He's a senior superintendent at Suffolk. He has built success on job sites through strong and transparent working relationships with all stakeholders throughout the project life cycle, and he ensures that projects meet or exceed all standards for safety, constructability, quality, scope, compliance, and trade partner management. A great CM in terms of what we all ascribe to do. Drew has provided on-site leadership at iconic Boston area projects, included the Winthrop Center, Encore Boston Harbor, Millennium Tower, and the Liberty Hotel. Drew has a BS in civil engineering from Northeastern University. Our prior keynote speaker, Brigadier General retired Jack Hammond, is the Executive Director for Home Base Program, which is a partnership between the Massachusetts General Hospital and Boston Red Sox. Home Base has provided mental and brain health care and support for more than 20,000 veterans and military families over the past decade, and established the nation's first private sector center of excellence for invisible wounds of war. General Jack Hammond has advised President Obama's Commission on Military Compensation and Retirement. Hammond has advised President George W. Bush's Warrior Wellness Alliance, Governor Mitt Romney's Homeland Security Advisory Council, and Governor Charlie Baker's Healthcare Transition Team and Veteran Advisory Council. A proven combat leader, General Hammond simultaneously commanded 2 separate battalions in Iraq, and as a general officer, he effectively led a multinational NATO task force in Afghanistan. His military awards and decorations include the Distinguished Service Medal, 2 Legion of Merit Medals, 1 for combat service, the Bronze Star Medal, 2 meritoriously service medals, 5 Army Commendation Medals, 1 for valor, 2 for valorous unit awards, the Combat Action Badge in the French Medal of National Defense, and the Bulgarian Medal of Mission Support. After that, I think I need a drink. Jack holds degrees from the University of Massachusetts, Boston University, and he has completed a National Security Fellowship at Harvard University. Laura Lakin is the Director of Administration and Business Analytics at Home Base, a Red Sox Foundation and Massachusetts General Hospital program. She has worked at Home Base for over 7 years, starting as a Veterans Outreach Coordinator in 2013, and has held a variety of outreach and administrative roles throughout the time in the organization. She was redeployed from within Mass MGH to Boston Hope at the start of the operation, where she served as the site manager, or as the general called her, the site commander for the 1,000-bed facility. Along with her role at Home Base, Laura is also an Army captain, currently serving in the Massachusetts National Guard as a company commander. Captain Lakin deployed to Kabul, Afghanistan in 2011 as an operations officer, receiving the Afghanistan Campaign Medal, Joint Service Commendation Medal, and the North Atlantic Treaty Organization Medal for her service. Laura began her career at Home Base as a Veteran Outreach Coordinator in 2013 and has held a variety of outreach administrative roles throughout her time in the organization. Laura received her bachelor's degree in political science from Drew University and her master's degree in social work from Boston University. So that that's our panel. Some great people with great roles who had a significant input into this job. And for me, I actually would like to bore down a little bit and find out how some of these things happened that we saw and witnessed. And so, being because I like a little bit of the backstory, I'm going to start with Jack Hammond. And Jack, could you share some of what I'd like to call the Paul Harvey rest of the story moment of your conversation with the governor late in March as COVID-19 was skyrocketing around the country, especially the West Coast and New York City began to rise dramatically with hospitalizations surging?
Well, thanks again, Michael, and really thank you all for coming together to listen to a little bit about the story on Boston Hope. I would tell you, as the backstory, you saw all the work from that amazing Suffolk video and that way too long video for me where I kind of went into more details than most people probably were interested in. But I would tell you, I can imagine if you put yourselves in my shoes and you get off the phone with the governor and agreed to do what you saw then happen, it kind of gives you a moment of pause when you reflect back for a second and think, oh crap, I actually got to do this now. And without partners like Suffolk, without someone like Laura Lakin on the ground, working 18, 20-hour days to get everything moving, to bring together, 1,000 employees that didn't work together. And in most hospitals, as you can imagine, you have hard and fast teams that have been working together, bracing for this COVID impact. With us, it was a pickup game, and we had to build teams and grow pods on the fly, and hire people and put them together, train them very quickly as the patients were coming through the front door. And at the same time, Laura would be running around with Drew saying, hey, we need 100 of these beds need oxygen lines, and the oxygen tank's not going to work because if we knock one over, it could blow up. So we had to go to a much better system on oxygen. The power was there. And then as you look at the different, as Mayor Walsh pointed out, there's a lot of egos in the room when you're working with the State House, the City Hall, all of the partners system, and then all the constructions, and on the construction side, union, non-union, Boston Police, State Police, the military. But everybody did come together, as Laura pointed out, because first of all, failure wasn't an option, and they all knew what was at stake. And I really think that's what pulled everybody together. That can-do attitude where, no regulations or inspections were overlooked. They were all done, but because of the confidence the city had, the state had in Suffolk and their commitment, they really handled this process very, very expeditiously so that nothing slowed us down and we could move forward. So it was pretty incredible.
That's great, Jack. I appreciate that. I'm gonna switch over and catch Jason from also the 10,000 foot level, looking down from Suffolk, and then I know Suffolk was involved earlier before the decision to build this, as they were kind of preparing for what's going on, and working with the mayor's office, assisting them with their own logistics of dealing with things in terms of how quickly they could react. So how far into it, with that early relationship did it go before, when this became an idea, which quickly became a plan? What was that quick transition like?
No, thank you, Mike, and thank you everyone for joining and listening a little bit about this special opportunity we were all involved with. And Mike, can you hear me okay, just to make sure?
Yes, you sound good.
Perfect, excellent. Honestly, it really wasn't that long. As you heard in the video, this happened to all of us so quickly. You really didn't have a lot of time to prepare. So I think it was a few weeks prior that the conversation started that we actually mobilized on that Saturday morning, like Drew had mentioned, to execute the work. And it was one of those things where we got the idea, we started coming together, we planned the facility, and something that I don't believe was mentioned, that it was initially a 500 bed facility. The decision to go from 500 to 1,000, I think, happened on the second or third day into the build. So the initial 500 bed layout was done without actually visiting the convention center. And when that actually happened and we had the opportunity to go, because at first it really wasn't known whether it was BCEC. I think Hines was also discussed, a few other locations. Once it was decided that it was going to be at the BCEC, and we had a chance to go and take a look at it and realize that they had this amazing infrastructure that was already kind of baked in because of what the different type of events that occur at the BCEC, that we had to kind of tweak the plan early on or late on into the planning stage to take advantage of this great infrastructure that we had. So it wasn't I'd say 2 or 3 weeks before we started really doing the work that the idea first started, that it all came together, which again, it just speaks to how all these great different people, different organizations, the city, the state, everybody came together so quickly to do this. In normal circumstances, that would have taken months, if not years, to come up with something like that. So didn't take that long at all.
No, thanks for that perspective. We got a sense during the two videos how quickly things are moving, and that actually just brings us right into where that is. Actually, I'm going to bore down just a little bit, Drew. As Jason mentioned, all of a sudden, day 2 or so, and you addressed it in the video, you were told, hey, 500 more beds are coming from an assignment. And as you called your New Hampshire panel guys, so what else did you think? What else, all of a sudden just ran through your head in terms of the ability to still meet the deadline, but get that done? I'm sure a bunch of things that, if you just share a few of them.
Yeah, sure. Obviously when we found out we had the initial 500 and we got rolling out there on that Saturday morning, we got into a pretty nice rhythm. When the news came of the second Hall B being built out with the additional 500 beds, and then there was acute rooms and rehab areas that people spoke of. Kind of took a few minutes to sink in, but knowing that regardless, the end date wasn't changing, we did make those phone calls and we started sourcing out to our vendors and locating not just the additional panels and the prefab panels, it's the nurses' stations, it's the lockers in the rooms, the curtains, and and everyone was, I think, after the initial shock set in, or everyone was really excited and really was looking forward to the opportunity to get that done as an additional pressure. It's fun.
Actually, that actually brings me back to a question. I know while all this is going on, I was watching, like everyone else, we were watching the daily, 6:30 news, national news, and at the same time, that this was going on, they were building out the Javits Center in New York, another big convention center, but they actually did it with the Army coming in and building a field hospital like they were in the field with tents and everything. What made you guys do it different at the convention center?
Well, I think there's a couple reasons. Number one, the product produced by Suffolk was 5 times better than the quality of the product at the Javits Center. At those other sites, they used all pipe and curtain, so there was virtually no privacy for the patients, and so that was not something we were interested in at all. The second reason was, despite the fact that it was a much inferior product, it was 4 times the cost, and so that was just not tenable. The folks at Suffolk gave a great price, and they didn't undercut anything. It's just, I'm not sure why this other thing was crazy expensive and really not a great product. So that made it a very easy decision for us.
That's interesting. It's almost in one way counterintuitive, but then after explaining it, it does make sense. So Laura, as being the site commander, you had Suffolk building your facility in terms of what was needed, but you were actually dealing with all the other logistics in terms of lining up the the staffing, the supplies coming in. How did that all work, and where did the supply chain come from? As everyone was screaming for medical materials at that time.
So in a lot of what Drew was speaking to when the ad for the 500 additional beds came, along with that came all of the other extra pieces, and all of those, unfortunately for them, came from me. So that was working closely with our medical teams to really think through what is every little bit of equipment or supply that is needed for patient comfort, but also patient care and safety. So, when you just are outfitting a hospital, you have a lot of time to do all of this. And for us, we had to do it really quickly and make sure we weren't forgetting anything. So a lot of the kind of, I'd say, non-medical supplies
Suffolk was able to procure through various subcontractors and vendors. So we're talking office chairs, the nursing station desks, filing cabinets, things that would have been impossible for us to procure through the partners or the Mass General Brigham supply chain. And then on the medical side of things, it was, sitting down with the doctors, walking them through kind of every piece and saying, okay, what are all the medical supplies that we're going to need? And it was medical supplies and consumables, but also all this medical equipment. So asking hospitals, well, hey, can we borrow a portable X-ray machine? And we need some stretchers, and things were just coming in every day at all hours of the day into the loading docks. And then it was unpacking everything, figuring out where it's going to go, trying to keep accountability and figuring out where everything came from. And a lot of that was done on the fly. I think you're muted, Mike. I can't hear him.
Excuse me. Thank you. I bumped my microphone. But that brings me back to the general's comment in his video where he's talking about that you guys were actually building that plane as it was running down the runway to take off. So that that's just part of the excellent story in terms of what all of this is about. Austin, do we have any people who aren't being shy and have raised their hand yet?
Yes, we do have one question so far. Just as a reminder to everyone, you can raise your hand through the GoToWebinar control panel if you have a question, and we'll move into the open question and answer segment. Our first question is with Bernard. Bernard, I'm going to unmute you from my end, but you might also need to unmute yourself from your own end. Please introduce yourself and ask your question. I think, Bernard, you're able to speak.
Okay, hey guys, just congratulations on a great project. Could you go into a little bit more detail in the ways that you dealt with the permitting and how you were able to get around that?
Okay, who's best to take that? Is that a Jason item or Laura? Or
yeah.
Who dealt with the basically just sweeping the permits aside?
So in terms of how we collaborated with the city and the state, right? Because remember, BCEC is technically on state land. So the permitting process there on a typical project is a little different than what we would do in the city. Obviously, BFD is heavily involved with everything there, but it's more at the state level than ISD at 1010 Mass Ave. But we worked in conjunction with the state and the city as well. Obviously, we couldn't go through the typical entitlement process and permitting, but work with them to make sure what we were doing was fast-tracked in a safe manner and making sure we were following as many protocols as possible. So we actually did get a TCO just so that we could start bringing in the medical equipment and the supplies. And we had the state building inspector there reviewing different things. BFD had involvement as well, making sure at their end that they felt the facility was safe. The oxygen tank especially, we actually had to build a little mini O2 tank farm in the loading dock, and we did that in collaboration with Boston Fire to make sure we were doing it in the safest manner possible. So certainly didn't push anything aside, but we worked together to expedite and fast track everything as much as possible.
And just if I could add on that note, this was a fully licensed hospital. It had to be fully accredited by the state. And so it ended up, partners had to spend about 4 or 5 days trying to figure out what type of license to apply for, and then actually push that through the licensing process. So that was that was a fully accredited hospital in Boston while it was open.
And along with that was also getting the pharmacy licensed and the oxygen and everything else. So it was a lot of lifts on all ends.
Well, this job definitely learned how to cut through the red tape. That's for sure. And actually, or more likely, with good faith efforts and doing all the right things, was able to deal with that tape afterwards in terms of some of this, I'm sure. So, Jason, I'm not sure if you or Drew, but as you mentioned, getting that decision to, oh, by the way, we need to outfit while you're in process rolling down the runway. You need 100 rooms set up for O2, and you hadn't even looked at procurement. How did that come together in like 5 days, from getting the equipment to locating it to plumbing it to getting it, flush certified, pressure tested? How'd that happen?
Yeah. So I give credit to Laura for making the phone call to Drew and I, and we're working up the courage to say, hey, by the way, I know we're 3 days out, but we need an O2 farm. But so really what we did is we piggybacked on the good work that had happened at the Worcester DCU Center, because they actually built their temp field hospital a little ahead of us, in a similar manner that the Javis Center was built in. But they actually had O2 at each one of their pods. So we immediately contacted the company Alliance Medical Gas, who had just finished that build, literally, I think the morning of when Laura had called us. Reached out to the gentleman there who runs the operation. He was phenomenal. He came right over to BCEC, walked it with Drew and I, and came up with a plan. It came together pretty quickly, because again, they had just done it. The tricky part though was sourcing the 2 tanks, one of which was about 900 gallons and the other one was about 350. And again, because the entire world was trying to do kind of what we're doing in terms of finding portable O2 bottles, O2 tanks of larger size, it was a little tricky, but I give credit to Alliance because they were able to find a company in Texas that had 2 of these tanks pretty much ready to go, and showed up pretty much the day before patients started coming to the BCEC, and kind of put it all together. Drew, from your perspective, anything you want to touch on there in terms of, I think we had to actually bring in a local company to finish the build with Alliance, just to kind of give them a little bit more support.
Yeah, we supplemented them with another local plumber, and just able to get it done. The interesting part was how, logistically, how we had to get it through the space to still allow, the patient traffic and access all around. We ended up using some of the in-house rigging companies that work at the convention center and hang some trusses down from the structure, and then piping along that and then feeding into the rooms. But beyond that, you had to get back out to the loading dock, which was a challenge in itself. They have these giant, they call them elephant doors that are on the ramps, and getting over there and out to the loading dock, above loading dock, and then out to the farm, as Jason mentioned. That was the farm itself. With the fire department, they added a inch steel plate. They wanted a 12-inch concrete pad, and all that was done, just in time before these tanks landed. Some Jersey barriers around them, and it was quite the process.
Yeah, and Mike, if I could just add one last thing to that, kind of off topic, but there were several trade partners involved with this bid out. Obviously, Suffolk didn't do this on their own. So American Plumbing and Heating, who helped Alliance Medical Gas with the O2 farm, JC Canestraro, Cox Engineering, McDonald Electric, Liberty Construction. We did this together, and there was more than just the names you're hearing today. But I think it's important just to mention those trade partners to get the recognition that they deserve.
Mike, if I could just add one thing on this, and I think this was kind of an unsung aspect. As you can imagine, based on the lethality of the COVID virus, we had to treat that 1 million square feet down in the exhibit hall as a hot zone and keep it contained, but we still had to feed, hundreds of people every day. We had to bring medical supplies in, we had to bring people in and out. And so on the one side of the building, we had the people entering and exiting and putting on their donning and doffing their PPE. But on the warehouse side, where the loading docks were, they had to then create these little openings, almost like you see in a lunar module, where they're encapsulated, and you could bring things into this cool area from the cold area to the hot area. They had to create a buffer space where it was completely sealed up, and you'd have to bring stuff into there. And then wait and zip it up, and then the other folks would zip it open and come in. And with all of this going on, there was a great deal of concern that many of the trades folks had to overcome and just working in this environment on a daily basis. As you know, it's counterintuitive because everybody else in the state was told to shelter in place, stay home. These guys were brought into the most highly concentrated COVID positive place in the state. And they all did it every day because, again, they were committed. We also had to go through some training and education so they understood what to do and how to operate safely. But I mean, that was a very big challenge, and we were awfully proud of all of them for overcoming any concerns and then taking the leap of faith along with the rest of us and working in that environment.
That's a very interesting and good point. I think some of us that are CMs may be more familiar with dealing with lead areas or asbestos, where we have to go through some negative ventilation to control things, and go through the zip out and close out area, or even with some radiation type work. But you're right, no one knew how this thing at that point in time spread or traveled, and you had to put every precaution to it. And without question, is trying to go fast, you've got to go slow for certain things. That's just a testament of everything. It just amazes me. That actually gets me to a question about progress, deadline, how we got this thing done. Laura, Drew, I know you guys must have been coordinating, but basically I'm curious about how you tracked progress, how you reported up so that that Jack and Jason knew what was going on, so they could report up how well things were going on. So I look at this as a kind of a bottom up. So Laura, Drew, in terms of how did you track things? Was there a war room or two stages of a war room that you had?
Sure.
Yeah, so during the build out, there was an 8 a.m. and a 5 p.m. meeting every single day with everybody. And a lot of that in the very early stages was virtual, which was pretty interesting. And then once we finally started to get in person, a lot of that reporting was happening in the moment. Lots of text messages, phone calls, pretty consistently and constantly. And probably an embarrassing amount of times I'd called Jason, Drew at all hours of the evening in those early days. But the progress was getting, in that build-up phase, I think was almost instantaneous. Probably the Suffolk guys probably had a more defined way to do that, though.
I mean, there was nothing fancy. It was Jason, trust us, we'll get it done. We'll figure it out and we'll work from there. But we set up our own.
You locked up, Drew.
War room or even a field office just on the floor. We started in Hall C where we had the most. As we progressed out of there and went into the second 500 beds, we moved our operations, and then we jumped down to the third hall, which became the storage area, and then eventually up to another floor. But it was kind of the central point for anyone that was working for us there, working with us. As things came up, the staff from partners and from home base they know where to find us. They didn't have our phone numbers, and then. Beyond that, it was kind of a central spot for our guys too. I mean, we went the 24 hours around the clock. We had the 3 shifts. There was a couple senior level guys there that did the 5 a.m., the 4 a.m.s to the 8 p.m.s, and kind of overlapped with all 3. And then had our supplemental staff coming in for the more standard shifts, the 8 hours, and getting them refreshed and coming back. So it was so we did it.
So if I could just board on a little bit in terms of that. So, basically the CM world, we've been refining our reporting and all of our latest software, and we're basically we're beyond P6 and we're into all kinds of incredible things for tracking progress and whatnot. But I would guess that this thing happened so quickly that basically you knew what you needed to report on, but I'm kind of guessing that you went old school and basically maybe there was a simple series of Gantt charts on the wall and you did manual updating with markers, or was it even less than that because you just knew what you had to do?
It was even less than that. It was just constant communication between everyone that was there, and there was we knew where we had to be. We knew what was coming. It was constant updates, and there was not as pretty or as fancy as all the technology we have today. I think by the time we would have gone into any of those systems, would have been after the job. So,
I think
the only. Go ahead, Laura.
I was going to say the one thing that was probably more traditional is we did eventually get to the point where we had a punch list, and Jason and I would track that down and work on those things. But unfortunately, probably for Suffolk, we kept adding things to it. one of which being 3 handicap accessible bathrooms that were going to be on the floor of the BCEC. And somehow they made it happen, but I'd say that was one, that was after the dust settled a little bit though.
Yeah. You know, I think during the build, the one piece of technology we did utilize, and Laura would get changes throughout the day, get information that needed to come to us. It would be either updated in a PowerPoint or maybe a PDF, but we would utilize Procore, the drawing tool inside Procore, to update the layout as much as we could as information was coming in. And then we had a big called a Surface Hub on the job, which is a big 60-inch touchscreen. And we utilized that just to communicate the changes that were occurring, usually on hour.
Yeah. So you basically were working constantly on a live plan that was being updated continuously. Yeah. Wow.
Yep. Laura liked to draw. She liked to draw.
So the other thing I just, as a threat to some of our partners in the CM industry is basically all you project control guys, you weren't needed. It's no, just kidding. So I think, so yeah, in terms of, I'm looking at also on the staffing side, General Laura, I know it's one thing to say, okay, you maybe have 2 weeks notice that you're going to have this thing, and then you figure out how you're quickly going to build it, then it happens a week later. Where did all these staff people come from? We needed to keep the hospitals alive. You couldn't just pull them all out of the hospital chain.
So that was the key challenge that we had, because you couldn't take anybody that the hospital needed. And so what we did was we recruited folks that worked outpatient care in a variety of places, from staffing agencies to the Mass General Brigham to Boston Medical Center and Beth Israel Leahy. And what we started out with a great core of people that were handpicked by each of the hospitals in Boston to help us out, to get us started. But then we developed a pretty unique staffing model where we said, we're going to have 12 pods of 48 patients. And then they figured out what the staffing model was for each pod. Then we had to recruit X number of nurses, doctors, et cetera, and then train them, because a lot of them had the basic skills because they were registered nurses, they were doctors. And then we would sprinkle out the highly qualified emergency room docs that were working shifts back at their parent hospital and then ours. So we had experts on every level. But as I mentioned in my video, Rich Ehrlichman, Dr. Rich Ehrlichman. Rich is a combat surgeon. He served in Afghanistan with me, but in his civilian life, he's a full professor at Harvard Medical School, and he's one of the nation's top plastic surgeons. During the COVID-19 era, there was no plastic surgery being done, so he was definitely available. But he had to shake off some, and find, he is highly qualified to be a plastic surgeon. He had to get back into basic medical operations, and he's eminently qualified, but he needed a refresher. So there was a whole training process that had to be accomplished on the ground, where we built a team, trained a team, and then we started receiving patients, and then we'd start again. And then we got the great news that the Army Reserve was going to send us an entire field hospital that could man and operate an entire 48-person pod. And it came right at a pivotal moment when we were running out of recruits, which enabled us to open that pod. We kept recruiting, and that's how we were able to reach full staff and almost hire, I think it was 1,200 people total.
Wow, 1,200. Besides the build crew of 300 per shift, when they were done, you had 1,200 people working in the facility.
That's correct.
That is truly amazing.
It was a 24-hour operation, and so
that was truly amazing. So, actually, Austin, we've been doing a lot of talking amongst the panel and myself. Do we have any other brave souls who want to ask a question?
Yes, we do. Our next question will be with Tom Ellis. Tom, I'm going to unmute you. Please introduce yourself and ask your question.
Okay. Can you hear me?
Yes.
All right. Well, there's a lot of discussion about the recent spikes in the pandemic across the country. If unfortunately that would happen again, what did you learn from this effort, and what would you do differently if unfortunately this had to be replicated? Thank you.
Who'd like to take that? Jack, Jason, from the big picture, or we want to.
Well, I can. General, I don't know if we want to mention what's kind of already been done. Maybe that's a good lead-in to how we are prepared if this does happen again.
Why don't we share that? And I know Laura and.
Yeah. So when we were our patient population was dwindling down and we were seeing less numbers, which is a good thing. At about the end of May, beginning of June, we started to prepare to kind of mothball the facility. And that wasn't immediately aware that that was going to be the course of action that we were going to go with, but that's what we ended up doing. And then in about mid-August, we got the call that we were going to start to actually break down the BCEC. But we wanted to make sure that we were prepared just in case with this pandemic that something were to happen again. So we did ultimately end up storing about 250 beds worth of not only equipment, but a lot of these prefab walls that were created. Obviously, we handled them quite differently than the ones that were getting thrown away. But we do have 250 beds worth of supplies, equipment, and materials ready to go. I think, and I heard this morning on the news, a new field hospital was just built in Milwaukee. So I think this is still an avenue that cities are going with. I think if we were to rebuild it, I think about 250 beds would be the right number. I think long-term cities and hospitals, states are going to probably look at how they can build their hospitals differently to be able to be more flexible. So if you need, more rooms that can be negative air, or be able to have a different way to surge your patients and move your patients around in existing hospital facilities. But obviously that can't happen overnight. So I think for this current situation, we do have a plan ready to go, and I think we would be able to be a lot quicker with how we build everything out because we have everything kind of waiting in reserve.
Well, that's good. Go ahead.
I'd also add that, I think our first recommendation to the state would be not to build the other 4 sites like they did last time and focus on one. I think they tried to have them in a regional build out plan, but the reality is no one can come visit you in this environment. So it's a car ride. You're better off investing all your resources in one place. And as I think Jason mentioned in his interview, there is not a more perfect place than the BCEC to do what we did. It was away from suburban areas. There weren't any people living close by in close proximity. We had all the access points we needed. We were able to set up outdoor every power generation, bathroom, shower units. We actually, and you don't like to talk about, we also had to have an outdoor morgue area established in case we lost somebody, but fortunately we didn't. But with all those things in mind, we're prepared. We have all the playbooks in place. So if needed, we can build it up very quickly again this time.
Okay, we've got about 3 minutes left. So I'm going to basically do a rapid round for each of you to kind of a follow-up, some thoughts, and basically picked off a question I'm going to ask. And basically, Drew, you talked a little bit about shift work and turnover, but basically, what type of days were you putting in really, and when did you sleep?
I was normally on site from about 4:35 a.m. until about 8 o'clock at night during the initial build. Luckily, I live nearby. I'm not too far from the CEC, so I didn't have a long commute. I was home within less than 10 minutes, so stuck a nap in every night.
Yeah, you were a real trooper, putting in basically double shifts for a week.
Had to get done.
Exactly. So Solar, you've worked with the general before, and you're affiliated with them in Afghanistan. How was this this mission compared to those missions?
Sure. So I deployed with General Hammond, and then also obviously work with him now at home base. I would say that Boston Hope was a little bit of a glimmer into our past, a little bit more of what we would be used to in the military versus what you're used to in the civilian world. That kind of rapid decision making and ability to kind of assess situations on the fly and make a sound decision based on the information that you have was really a little bit more, I think, the pace, maybe not that we would want all the time, but a little bit more of the pace that we were used to.
I'm sure. Thank you. So Jason, what's the biggest lesson learned from Suffolk that they got from this rapid build and in meeting the requirements of the mission and getting this job done?
No, I think it reinforces what we've all already know. You know, in times of need, when everybody's back's against the wall and you need to do something special, how amazing it is. Everybody comes together and pushes everything aside, like we were saying earlier, to do something like this. So I think it was just more of a reaffirmation of what we all know is inside us all, and it was just great to be a part of it.
Okay, and in general, I'd like to finish up with you in terms of basically your thoughts. Basically in terms of all the different missions you've had, how does this one rank up to basically everything else you've done leading up to this basically 2-3 week event that was Boston Hope?
I would tell you that having deployed across the world in expeditionary operations, whether it's Iraq, Afghanistan, Bosnia, you name it, it's about the team you build and you have there. As I mentioned earlier, we normally leave with a team that's intact. Building one on the move is just a very, very unique experience. And in these expeditionary environments, you see the best and worst in people. You see people at they're most vulnerable because they're working these 20-hour days, day after day after day. And what we were fortunate to see at Boston Hope is we really did pick the right people. You didn't see that bad side. You just saw everybody trying to do more and more because they knew there were sick people, and if we didn't do our job right, people could die. And I think that was the driving force for everybody. And so you saw the best in people. And so I would rank this right up there with any deployment I've ever had.
Well, great. Well, I thank our panel today. This was great. I got a lot more out of it, and I've been following it for some time. Was involved with helping pull together the original presentations that we did at our chapter. I thank all the attendees for coming. Sorry, it was difficult to get to too many questions, but I think we had a good rapport with the panel, and I think we were actually bored down on some of the issues that were interested to the folks that attended. And I said, I thank you all. Very pleased with this event, and everyone take care and enjoy a nice weekend. Bye now.
Thank you.
Thank you.
Thanks.